Hello, everyone, and welcome to Medical and Healthcare Environments, Chapter 4. The objectives that we're going to go through in Chapter 4 are to understand the various sites of healthcare practice and the practice and the categories of healthcare services, explain care coordination, explain population health management, define patient-centered medical homes, and understand the role of interprofessionalism. Our continued objectives are to describe the importance of the health services manager's participation as an equal member of the interprofessional team, define patient experience, and explain the role of the patient as a member of the healthcare team. The case study of Maryland's local overdose fatality review team illustrates the importance of interprofessional teams to identify recommendations to address the issue of overdose fatality. It also identifies 6 key principles for effective interprofessional teams and provides a concrete example of the impact potential of interprofessional teamwork on care coordination. So in 2014, Maryland formed the local overdose fatality review team with the purpose of reviewing overdose fatalities in the state. In 2013, there were 858 reported drug overdose deaths in Maryland, which was more than the number of deaths caused by car accidents, homicides, and suicides. So with the governor's support and state legislation that developed guidelines for the team, and then with financial assistance from the U.S. Department of Justice, they provided a grant. They assembled professionals from public health, local hospital, emergency medical services, county behavioral health services, and law enforcement, along with some healthcare experts specializing in substance abuse and treatment. And they formed 15 of these teams to serve as multidisciplinary teams that evaluated about 200 overdose fatalities. The team's findings revealed that existing care coordination efforts needed improvement, as many of the deceased had had contact with each department, that is, social services, criminal justice, and healthcare entities. In particular, older drug users were found to have co-occurring chronic health issues. So the teams concluded that if a person has an overdose history, improved coordination and communication among these public and healthcare agencies might help improve the referral system and change intake questionnaires to more fully assess the patient's risk of overdosing. Now, they were able to come to this realization due to their ability to communicate, ask questions, and gather and analyze data. So these LOFRTs illustrate the value of interprofessionalism, which is an interdisciplinary healthcare team comprising members from different health professions as defined by the Institute of Medicine. That definition is an interdisciplinary team is composed of members from different professions and occupations with varied and specialized knowledge, skills, and methods. So to belong on an interprofessional team, members must abide by 6 key principles. 1, the willingness and capability to work both collaboratively and inclusively. 2, an understanding of the nature and extent of their duty of care, both to those who use their service and to their colleagues. 3, maintaining respect, confidence, engagement, willingness to negotiate, and readiness to share in relationships with colleagues and clients. 4, the willingness and capability to communicate clearly what you want and believe and to listen to what others want and believe. 5, the commitment and capability to develop and deliver mutual, acceptable shared plans. And 6, the willingness and capability to contribute to shaping change and to welcome contributions from a spectrum of other stakeholders in the services you offer. So in this interprofessional environment, each team member adds his or her knowledge, skills, and methods in collaboration with the others. So like this team of professionals in the example of the LOFRTs, they all came from different organizations. They exhibited the key principles of interprofessionalism and were therefore able to make recommendations with the aim of improving the coordination of care, a key term, which is deliberate communication and organization of healthcare actions between two or more providers and the patient to ensure better healthcare outcome. And they delivered that to the person in order to reduce drug overdose fatalities. In the next few slides, we're going to cover categories of health services, with the first one being health promotion. Health promotion defines activities that are designed to influence individual behaviors that affect personal health. The goal is to keep people healthy by encouraging them to adopt a healthier lifestyle and increase health literacy. A lot of this has to do with health education activities and certain initiatives to measure. Disease prevention. The disease prevention category consists of the result of education and other health promotion efforts designed to help people become healthier and stay healthy and live healthier lives. The key is the patient's role on the healthcare team that include patient responsibilities to be proactive. There's some accountability on the patient's part as well. Diagnosis and treatment represent the most widely used healthcare services. And rehabilitation, which consists of therapies that help restore someone to normal or close to normal life. The social determinants of health are the conditions in which people live and work that affect their access to appropriate health care and their ability to be an effective and responsible patient. If you remember, we previously discussed healthcare's iron triangle of cost, quality, and access. Some people enjoy more quality of care than others. They have insurance or they have the financial ability to pay for health care. Other people cannot afford the benefits of technology to help them improve their health, or they may have unreliable transportation to travel to healthcare services. Consequently, the conditions in which people live influence their health. These conditions are referred to as social determinants of health and help explain why some of us are not as healthy as we could be. Community healthcare centers and clinics It's one of a network of clinics that are designed to provide patient care in a designated area. They have the mission to serve those who have less access to health care because they have a lower income, are under or uninsured, or otherwise lack the ability to pay. These community healthcare centers are typically private nonprofit organizations that provide health care to residents of a defined geographic area that is medically underserved. That is, fewer providers are locally available to administer healthcare services. Federally qualified healthcare centers, or FQHC, that's a clinic designated to serve an underserved area of population that offers a sliding fee scale and comprehensive healthcare services. They receive funds from the Health Resources and Services Administration, or HRSA. Care is focused primarily on primary and preventative care that is designed to promote wellness and prevent disease. But diagnosis and treatment are also provided in the clinic setting. The World Health Organization defines hospitals as healthcare institutions that have an organized medical and other professional staff, have inpatient facilities, and deliver services 24 hours per day, 7 days a week. They offer a varying range of acute, convalescent, and terminal care using diagnostic and curative services. A post-acute care facility is a facility that offers a continuum of care depending upon patient or resident need. You can find post-acute care facilities in the form of long-term acute care hospitals, primarily for patients with long-term respiratory needs, extended ICU care, that type of thing. They're called LTAC hospitals. Also rehabilitation or post-acute care facilities providing physical, speech, and occupational therapy to restore patients back to as near as normal as possible. Then medical group practices, which has been a movement from solo physician office model to medical groups. And now by 2017, about 1/3 of physicians are employed by a hospital-owned practice, meaning the hospitals have acquired the physician practices. And so about 25% of practices are hospital-owned. Patient-centered medical home is a healthcare delivery model in which the primary care provider ensures the patient receives the right treatment at the right time by the right provider in a way that they can understand and that helps them be an active participant in their care. Again, the accountable care organization is a form of health services delivery that includes multiple kinds of providers who work together to improve care delivery to the individual patient and the health status of a particular population, such as a group of employees or Medicare enrollees. The providers work as a team because of a reimbursement mechanism that incentivizes improvement in patient outcomes. The term population health refers to the health outcomes of a group of individuals, including the distribution of such outcomes within the group. The field of population health includes health outcomes, patterns of health determinants, and policies and interventions that link these two. A triple aim, the goals indicate the goals of improving the patient experience and health of the population while reducing healthcare costs. So accomplishing this triple aim relies on a practice of cost control, patient-centered care, integration and coordination of health services, and a focus on health promotion to keep the population healthy. Which leads into quadruple aim, which is the goal of improving the patient experience, the health of a population, and the provider's experience while reducing healthcare costs. So in these last two slides, we want to just recap our points to remember. Various sites offer healthcare practice. The trend is moving from inpatient to outpatient care with a focus on health promotion and prevention. Although individuals must take responsibility for their own health, social determinants of health affect their ability to do so. Social determinants of health are shaped by income inequalities, power distributions, and the resources available. Patient-centered medical homes and accountable care organizations emphasize care coordination, and interprofessionalism is important for improving patient care and containing costs. Improvement to the U.S. healthcare system involves meeting the quadruple aim of care: health, cost, and meaning in work.